everyone, welcome back to our Fine Nursing Tutorial YouTube channel. In this class, we are going to discuss with colon cancer or colorectal cancer. Colorectal carcinoma also we can see. Who all have visited first time on this channel, please do subscribe and watch. Here colon cancer, then colorectal carcinoma or cancer we can call. And then cancer involving the large intestine or rectum. And then tumor or growth may affect right colon, left colon or rectum. And then malignant growth arises from polyp. Next we'll see the epidemiology about this. Here it is a fourth most common type of cancer. Approximately 5% of cases are attributed to genetic causes. And then most common cause of large bowel obstruction in adults. And also risk factors: older age, low fiber intake, family history, and then history of inflammatory bowel disease or disorders. May be asymptomatic but can cause variety of symptoms and complications. We'll see the signs and symptoms here in this class. Here, onset of signs and symptoms occur with advanced disease. First one, there will be the abdominal pain. Abdominal pain, most common symptom presenting to the clinic, and then may be caused by partial or complete obstruction by the tumor or growth. And also there will be the invasion into the spreading into the peritoneum may also occur. Abdominal pain, and the next one is the stool changes, caliber of stool, and then pencil shaped stool we can see, and then thinner stool. Next one is a bowel habit changes. Bowel habit changes here, more likely to occur with left side colon tumor, and then right sided colon tumors unlikely to cause bowel habit changes, and then alternates between constipation and diarrhea. Third one is a bowel habit changes, and comes to the fourth one, weight loss. Losing weight may occur in CRC, colorectal cancer. And then fifth one is a fatigue, one of the most common symptom of colorectal cancer due to cancer related changes. Next one is a bleeding. You can see hematochezia, bright red blood in stool, and then more likely with left sided colonic tumors, and then melena, more likely in right sided colonic tumor. Anemia, blood losses from hematochezia, melena, and then occult bleeding. And then due to iron deficiency, other causes ruled out here, and then signs and symptoms of iron deficiency anemia also we can see. And then eighth one is a weakness that is related to anemia. Next, ninth one is a palpable mass. We can find abdominal mass may become palpable. And then 10th one is constipation or obstipation. Here decreased frequency or increased consistency of stool, and then cessation of bowel movements caused by partial or complete obstruction. That's all about the constipation. And then next comes to the 11th one, that is nausea and vomiting due to gastrointestinal mobility. And comes to the 12th one, that is abdominal distension. Here due to increasing volume of air or gas within the gastrointestinal system from obstruction. Severity depends on location of obstruction. Next, fever. Increase in body temperature may occur if bowel strangulation or perforation occurs. And then next one is a tenesmus. Here feeling or sensation of urge to defecate, and then sensation of incomplete evacuation. Yes, sensation of incomplete defecation we can see. Next, sign and symptom is about liver. Here hematogenous spread by portal vein, and then can cause signs and symptoms of liver disease. And then comes to the lungs. Here hematogenous spread by inferior vena cava. And then lymph nodes. Here supraclavicular lymphadenopathy. We can see in the picture there, supraclavicular lymphadenopathy. And then there will be the swelling, and we can find there. And then spread through lymphatic system. This is all about the signs and symptoms of colorectal carcinoma or colon cancer. I hope you all are very clear with the topic. Please like, share and subscribe to our YouTube channel for more informative content. Thank you for watching.